Honorable members of the PTF, ladies and gentlemen of the press, good evening. I hope you've had a good cell break despite the challenging times we're in. Today, I intend to talk about the roles and responsibilities of the different arms of government as it relates to the COVID response. This is partly because we get a lot of questions from members of the public regarding specific issues and clarifications. So, although this list is not an exhaustive one, I hope it will provide some of the information that the general public need to know. So, in terms of the government agencies, obviously we have federal and state structures. Under the federal structure, we have the Federal Ministry of Health. What is the role of the Federal Ministry of Health when it comes to the COVID response? Well, first of all, they are primarily responsible for policy formulation as far as the health sector is concerned. They are responsible for providing psychosocial support, and also through the Ministry of Labor, ensuring health workers are provided with allowances, life insurances, tax rebate, etc. The Federal Ministry of Health is also responsible for strengthening and improving patient and health care through supporting state government health structures to ensure all COVID-19 patients are treated. And then finally, they are responsible for the certification of medical products. So anything you take in terms of food or drugs, working through NAFDAC, NAFDAC is responsible for coordinating this. So that's the Federal Ministry of Health. What about NCDC? NCDC primarily are responsible for the public health response. So here we are talking about provision of guidelines. For instance, we have guidelines on patient care. We have guidelines on case management. We have guidelines on burial of persons who have died from COVID infection. NCDC is also leading the effort in designing and implementing national testing strategies to scale up testing in Nigeria. They also coordinate a network of molecular laboratories for COVID-19 diagnosis across the country. But note, I said they coordinate. They do not own most of these laboratories, and neither are they responsible for the testing that occurs in most of these labs. NCDC support states in sample collection through capacity building at the state level. They also provide training to the states in terms of sample collection and testing. Finally, NCDC conducts risk communication training for community healthcare workers, as well as related public health communications and awareness campaigns. So that's the NCDC. What about the Federal Ministry of Information? The ministry disseminates information to sensitize Nigerians on the fight against COVID, as well as transparently communicate federal government activities on the emergency response. Foreign Affairs. The Federal Ministry of Foreign Affairs is responsible for mostly consular services, and they also take the lead when it comes to the evacuation of Nigerians wishing to return home as a result of the COVID-19 pandemic. The Ministry of Aviation gives access and movement rights, including essential air travel, particularly as it relates to health issues, and also helps us with approvals when it comes to the delivery of commodities by air. The Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development coordinates all humanitarian activities, and they also work with state government structures on the distribution of COVID-19 palliatives. Finally, at the federal level, we have the security agencies. These are responsible for ensuring compliance with public health recommendations, all the advisories we give as it relates to COVID-19 spread at the national as well as the state level. So these are the federal structures. So last week we talked about ensuring that state governments take more responsibility for the COVID-19 pandemic. So when I say more responsibility, it means getting them to do more, even though they already have responsibilities that are clearly outlined based on the Constitution and based on the provision of health services across the country. And these key responsibilities include collating and providing necessary information to aid the state investigate cases of COVID-19. States are also primarily responsible for the provision of treatment and isolation facilities. They are responsible directly for the clinical management of COVID-19 cases in their areas of authority. They also ensure best practice, patient care and treatment according to the guidelines set up at the national level by the NCDC. State governments are also responsible for providing PPEs, which are protective equipment for health workers in the state. But this is further supported at the federal level, but it's a primary responsibility of the state governments. And then finally, state governments are responsible for sensitizing the public on prevention measures and protocols on COVID-19. Therefore, last week when we said we will be pushing this response more and more towards the state side, we are simply re-emphasizing what the states have always been doing, rather than something new. But we intend to continue to work very closely with the states to make sure that this response goes down to the community level, because that's the only way we can make sure that the pandemic wanes as soon as possible. But of course, it's not just government. The public have a responsibility. We all have a responsibility. We all have a role to play. And what are some of those responsibilities? Obviously, this is not exhaustive, but when we are sick, we have a responsibility to ourselves and our families to contact the COVID hotline if we have any related symptoms. We must also provide state officials and healthcare workers with the facts, the necessary information that they would need, not only to treat us, but also to protect themselves from getting the infection. It's also part of our responsibility to comply with federal and state advisories, such as obeying curfews, practicing physical distancing, and wearing face masks. And finally, it's part of our civil responsibilities to cooperate and work with the security agencies as they deliver on their work. Of course, all of us need to collaborate with each other, because this is really a one government, a one community response. I hope this clarifies a few things. We do have a website. We will encourage you to continue to visit the website. It's www.statehouse.gov.ng/COVID-19, www.statehouse.gov.ng/COVID-19. Or you can email us directly at ptfcovid19@osgf.gov.ng, ptfcovid19, all one word, at osgf.gov.ng. Please keep on sending your questions and comments. We will read them and we will continue to address them as they come. Thank you.